In this world that we're so concerned about not polluting the environment, shouldn't we be more concerned about not polluting our own bodies? Aren't you tired of artificial methods of birth control? Did you not know that you're only fertile for about 100 hours in your whole cycle? Why then continue enslaving yourselves with methods like the pill, the patch, the NuvaRing, the implants, Depo-Provera injections? They are synthetic female hormones. Maybe they never told you that. They can cause 150 chemical changes in the woman's body. They have serious side effects on the heart, the brain, the blood vessels. They increase the risk of breast cancer, cervical cancer, liver cancer. And they can also give you heart attacks, strokes, blood clots, and irregularities, bleeding, vision problems, depression, ectopic pregnancies, and permanent sterility. Even the mini pill has just as many serious effects. Women don't even know when they use the injection, the Depo-Provera injection, that they can cause osteoporosis because they lose bone mineral density caused by this birth control method. And this is admitted even by the manufacturers of this harmful birth control method. It's inconceivable that they do this to women. In 2005, the World Health Organization classified the pill as a class 1 carcinogen, the most dangerous of all. Let me explain to you how these methods work inside your body, as admitted by the manufacturers and the physician's desk reference. They have 3 ways of acting. It may stop ovulation from occurring, but if it occurs, they say, don't worry, because the synthetic hormone that you're taking will thicken the cervical mucus discharge, making it difficult for sperms to enter. If any of these 2 measures fail, they say, don't worry, because with this pill, it changes the lining of the uterus, which is the food, the nutrition for the baby for the next 9 months. And it's so thin that when the baby comes down to implant, it doesn't have enough food to survive for the next 9 months, and it dies. And that is the abortifacient effect of the birth control pill, the NuvaRing, the patch, all those methods, the injection, everything. If women were told that they are being responsible for stopping the survival of their own child, they would be scandalized. Now let me tell you about the intrauterine devices. They are terrible for women. They are inserted inside the uterus through the cervical canal to be used as an artificial method of birth control, like introducing a fish hook. They cause pelvic inflammatory diseases. They also change the lining of the uterus so that it's hostile for the baby to implant. So they usually always act as an abortifacient. Imagine they have a synthetic hormone in the IUD to try to stop the penetration of sperm, but that doesn't always work. And the other IUD has copper, which is a poisonous substance supposed to kill the sperm, but it doesn't work that. So as a result, many women have a lot of bleeding in what they thought would be their menstrual flow, but it's probably because they're losing the baby. If women were told that, they wouldn't want to touch it, because these heavy hemorrhages are that. Some babies insist on surviving in spite of the IUD. However, those are very dangerous pregnancies, as the IUDs also can perforate the uterus and they can lose the baby. Or they stay there and it can cause a problem with the amniotic fluid. So some babies are born even with the IUD sometimes in their hand or embedded in their back. These are very dangerous pregnancies. What about condoms, you may ask? What's wrong with them? Well, they're not effective in preventing pregnancy, even though we know that the woman can only conceive in about 100 hours of her cycle. But it doesn't prevent venereal diseases like gonorrhea, human papillomavirus, chlamydia, AIDS virus, etc. You can contract those 365 days of the year. If condoms are not stored in a fresh and dry place, they deteriorate. Health authorities from the United States have concluded and admitted that condoms increase the risk of becoming infected with the HIV/AIDS virus. Because it's 500 times smaller than a human sperm. It goes right through the condoms. And they fail anything from 12 to 44% of the time in preventing pregnancy. They're even less effective in preventing the transmission of this tiny virus that goes right through the latex. So let's talk about sterilization then. Sterilization is the only surgical procedure conducted on perfectly healthy men and women. They have multiple side effects because they render a healthy organ into a dysfunctional one. The fallopian tubes are cut, burned, or blocked to permanently prevent pregnancy in women. In women, the tubes could be tied, cut, burned, or blocked to achieve permanent sterility. It is not 100% effective, as pregnancy can still take place 5.4% of the time. It can cause heavy menstruations, pelvic pain, decrease in sexual desire. 17% eventually end up having to have a complete hysterectomy. Many women still feel the desire to restore their fertility, which is quite interesting. In men, it prevents pregnancy by cutting and sealing the tubes that carry sperm into the semen. After vasectomy, the man is still producing sperm as before, about 50,000 sperm per minute. But this time, they're going through into the bloodstream. The serious side effects may be prostate cancer, kidney stones, possible risk of a type of dementia, memory and personality changes, depression, anxiety, and decrease in sexual desire. Why suffer all these physical and psychological and moral problems when there is a natural, healthy, simple to learn, 99% effective alternative to postpone pregnancy naturally or to help you achieve pregnancy if you have trouble conceiving? You may be able to recognize the few hours of fertility. I have the perfect natural answer for you. The ovulation method of natural family planning is 99% effective in postponing pregnancy and helps couples to conceive naturally. With the ovulation method, you can protect the health of your wife and share a happy and successful family life. I learned this method in Australia in 20 minutes. It is so simple to learn, and it made so much sense because God has placed those signs in our bodies, very obvious, but nobody ever explained them to us. And it worked so well that I couldn't believe it. I was skeptical at first because I said, it's too simple. How come the doctors haven't told us? How come the whole world doesn't know it? But, you know, I was skeptical at the beginning, and as I started practicing natural family planning with my husband, and each cycle worked exactly as I was told, I couldn't believe it. And I became a teacher, and I developed a simple system to follow, which is the one that Dr. Billings follows, and it's being taught all over the world. And it works for women with regular cycles, irregular cycles. If you have long cycles, the signs of fertility are going to appear late. If you're going to have a short cycle, the signs of fertility are going to be appearing early. It's that simple. It works even when you're coming off pill and artificial methods, which sometimes it takes a little longer for your body to get back to normal. And the book will give you a lot of information on what to do under those circumstances. Studies have confirmed that couples who practice the ovulation method almost never divorce. In 2002, we conducted a unique study comparing the practice of natural family planning with the ovulation method with those who use artificial methods of birth control. The main objective was to discern if couples who practice NFP are less likely to be divorced than those who do not. The NFP survey concluded that NFP couples have a dramatically low 0.2% divorce rate, are happier and consider themselves more successful in their everyday family life, share a more profound intimacy with their spouse, achieve a deeper level of communication with their husband, attend church more often, preserve the family unit more responsibly. In contrast, those who have not been given this enrichment have considerably higher divorce rate, separation and cohabitation rates. Marriages in violation of the natural law seem to be in a state of instability due to the lack of chastity within their marriage, resulting in poor communication and cooperation, and the denial of mutual responsibility in the area of responsible parent. Those couples seem to move from marriage to separation and divorce without ever experiencing permanency in their marital vocation. Natural family planning will change your life. You have no idea how many women have told us, "You have saved my marriage." Why? Because with natural family planning, both accept responsibility to bring life into the world or postpone it naturally. Neither husband or wife endanger their lives with the use of artificial means of birth control, nor the life of their offspring with the use of abortifacients. You will find it most rewarding when you begin receiving the benefits of living in harmony with your reproductive physiology. Talk about true liberation. Choose what's best for you and your family, because the truth will make you free. Everything you need to know about the ovulation method of natural family planning is contained in this book. You can follow natural family planning with normal cycles, irregular cycles, coming off the pill, breastfeeding mothers, premenopausal women, everything that will be contained here that can help you follow this method. It also has a computer program that you can keep your record with the computer. It has its own chart if you want to do it manually. Everything is here for you to follow the method. Women will find it very useful if you want to conceive a child, because sometimes after having used so many years artificial methods of birth control, your fertility has been damaged. As a result of that, your window of fertility has diminished from the normal 2 or 3 days, 100 hours. It could be just for a couple of hours, and that's the only time you could conceive. The other part that's so important is that when you use it to achieve pregnancy, you know exactly when you conceived and you know exactly when the baby is due. All you have to do is count the number of days of the pregnancy. And they're also very useful in helping couples who perhaps have several girls and would like to have a boy, or have several boys and would like to have a girl, because with this method they can tell when ovulation is most likely to occur. And we know scientifically that the female sperms are slower swimmers but outlive the male sperms, who are faster swimmers. Female sperms live 2 or 3 days, male sperms only live about 24 hours and then they die. So by timing the marital embrace at the right time, then you have a much better chance of conceiving a boy or a girl as you wish. I encourage you to visit our website, www.familyplanning.net, or call us to 1-800-443-3395. This way you will have a much more detailed information about natural family planning. Thank you.